This video is intended to provide you with general information regarding CMC osteoarthritis, along with management following a CMC arthroplasty. For more in-depth information regarding these topics, please refer to the virtual patient education handout corresponding to this video. Osteoarthritis is a degenerative disorder that typically occurs due to overuse and can affect many joints. Joints such as the CMC consist of two or more bones where the point of articulation is covered by a material called cartilage that allows for smooth, painless gliding. Over time, this material, along with the ends of the bones, will wear down and lead to pain, stiffness, and swelling. According to the CDC, around 1 in 4 adults in the U.S. have been diagnosed with some form of osteoarthritis. They have also found that this condition tends to be more prevalent with women than men. You will initially be recommended different forms of conservative treatment. Common conservative treatment options include activity modification and bracing to decrease the stress on the joint, injections to alleviate pain and inflammation, and physical or occupational therapy to improve the strength of the surrounding muscles to increase the overall stability of the joint. It is worth noting that conservative treatment will not be able to undo any damage that has already occurred to the joint. It is only meant to manage your symptoms and improve your overall quality of life. The only way to truly address the root cause of this condition is a surgical procedure. Once all conservative treatment options have been exhausted and you are no longer seeing any relief, your doctor may recommend progressing with surgery. There are many different types of surgical procedures to repair the CMC joint. Your doctor will provide you with specifics on which surgical intervention is most appropriate for your condition. However, the most common procedure performed by the surgeons at Campbell Clinic is called a trapeziectomy with ligament reconstruction and tendon interposition. During this procedure, a bone at the base of the thumb called the trapezium is removed. Next, a nearby tendon is cut and then redirected to fill the empty space where the bone was removed in order to stabilize the joint. Following surgery, the key components for recovery will include pain management, wound care, edema management, and physical or occupational therapy. You will be provided with further instructions regarding this by your doctor or therapist. Recovery for this procedure can be very slow. Some patients report a full recovery around 3 months following the surgery. However, some patients have reported full recoveries taking up to 1 year. For the first 2 weeks following surgery, you will be immobilized in a cast. At this stage, it is important to monitor swelling and stiffness of nearby joints. The best way to combat this is by elevating your hand above heart level and maintaining motion of your fingers. Depending on your surgeon's preferences, you will have your cast removed anywhere from 2 to 6 weeks following your surgery, and you will transition into a removable splint that is either prefabricated or custom made by your therapist. Once your cast is removed, your surgeon or your therapist will provide you with instructions regarding which range of motion exercises to begin. You will typically begin physical or occupational therapy around week 6. At this time, you will begin to wean out of your removable splint and start to focus on gradually increasing your range of motion and strength. Within weeks 10 through 12, you will begin to gradually resume using your hand for your normal daily activities. It is very important to remember that this procedure tends to have a slow recovery process. While some patients report a full recovery 3 months after their surgery, others may not experience a full recovery until 1 year after. As previously mentioned, for more in-depth information regarding these topics, please refer to the virtual patient education handout that corresponds with this video. And of course, if you would like to be seen by one of our surgeons, please contact the phone number listed to make an appointment at one of our locations.